There's been a generally positive response to the Australian government's massive wage subsidy plan to help employees and businesses through the coming months of this coronavirus crisis. That's one of the key elements to our coronavirus coverage today. The number of cases worldwide has passed through 750,000, and the US now accounts for about a fifth of all those cases. So here's a look at what's happening today. So the $130 billion JobKeeper program will see businesses receive a fortnightly wage subsidy of up to $1,500 an employee. The Prime Minister expects up to 6 million workers will access the payment over the next 6 months. New restrictions limiting public gatherings to just 2 people start today, with state and territory leaders vowing to crack down on those flouting the rules. Police can issue fines for breaches with penalties of up to $1,600 in Victoria and $1,000 in New South Wales. In Europe, Spain has reported 812 deaths just in the past 24 hours, taking the national total there to more than 7,300 people. The number of cases is now more than 85,000 in Spain. That's higher than in China, where the outbreak began. Meanwhile, Italy is extending its lockdown until the 12th of April as the country's death toll rose past 11,500. Health workers in India have sprayed a group of migrants with disinfectant as fears of the spread of the virus rise there. America now has more than 150,000 cases of the virus. A US Navy hospital ship has docked in New York City harbour to care for patients who don't have COVID-19, freeing up hospital space in the city for those that do. New York State is the centre of the crisis in the US, with at least 770 deaths attributed to COVID-19. And the coronavirus pandemic is now affecting at least 177 countries. More than 750,000 people have been infected by the virus, and more than 35,000 have died. So tens of thousands of businesses have already registered for the Australian government's emergency wage subsidy scheme. The federal government announced this $130 billion plan yesterday. Let's go to Noor Haider now at Parliament House in Canberra. So Noor, how many businesses have already registered with the tax office?
Well, Joe, as of 9 p.m. last night, more than 66,000 businesses had registered to take part in this scheme. What the government's going to be spending is an enormous amount of money. $130 billion will be spent over the next 6 months alone to essentially pay the wages of an estimated 6 million Australians. So the way this scheme will work is that eligible businesses will receive $1,500 per fortnight to pass on to their employees. Full-time, part-time and sole traders will be eligible to receive that $1,500 wage subsidy, and casuals will also be eligible if they have been in the same job for more than 12 months. Now, to get this money, companies have to demonstrate that their revenue has dropped by more than 30% compared to the same time last year. For bigger companies with a turnover of more than $1 billion, they'll have to show that their revenue has dropped by more than 50%. Now, the government says businesses can register for this scheme on the ATO website, and they're encouraging employees who feel that they may be eligible to talk to their employers to see if indeed they can become a JobKeeper.
And so, Noor, the government had already announced a doubling of the New Start allowance for people who'd become unemployed. What does it mean for people who'd lost their jobs in the last couple of weeks who'd already applied for that?
Well, Joe, you can't receive a JobKeeper payment and a job seeker payment. So for anyone who may have become unemployed in the last few weeks, or who may have been stood down or lost shifts and went to Centrelink to apply for the job seeker payment, they're being told they don't need to withdraw their application. The government will have a look at Centrelink applications and will also assess what businesses pass on to the ATO and determine what payment an individual can receive. Now, for more information, people are being told they can go to the treasury.gov.au website. There are fact sheets there available for both employers and employees to help them determine exactly how this scheme applies for them. The Treasurer, Josh Frydenberg, has told us that the money will begin flowing from the beginning of May, and payments will be backdated until the beginning of March, Joe.
Right. And what's been the reaction from unions and business groups?
Well, Joe, it's not often that you have business groups and unions on the same page, but these are unprecedented times and they have largely been welcoming of this scheme. So we heard from the Australian Council of Trade Unions and they say that this is very welcome. They have raised concerns about the fact that the scheme does not apply to all casuals and that there is that criteria that requires a casual to have been in the same job for 12 months. They're hoping the government will change that. But business groups also say this is a positive move. They say they have conceded, though, despite this scheme, some businesses will have to permanently close because of the coronavirus crisis. But as I mentioned, both unions and business groups are on board, and we know that the opposition are also supportive of this. Parliament will have to be recalled for this legislation to be passed, and the opposition has already said they'll be constructive and supportive.
Okay, Noor Hayter there in Canberra. Now, Virgin Australia has asked the government for a bailout as the coronavirus decimates the aviation industry. It's reported the airline wants a $1.4 billion rescue package. Reporter Steph Ferrier joins us now from Melbourne. Steph, good morning. So take us through exactly what Virgin is asking for.
Yes, good morning, Joe. Well, Virgin Australia has confirmed it's seeking federal government assistance to help it ride out this coronavirus crisis. Now, the CEO has written to the federal government, and while the airline won't detail exactly what was in that letter, it is understood to contain a request for a $1.4 billion loan rescue package, which would see the federal government take an ownership stake if the airline is unable to pay back that loan within 2 to 3 years. Now, of course, we've already seen the airline stand down around 80% of its workforce and make 1,000 staff redundant, as well as dramatically cut its domestic flights routes by about 90%. But the company says that it still needs to do more, and it's still taking these measures, and it needs some assistance from the federal government. Now, it has actually confirmed that in a statement, saying that if this crisis is prolonged, then support will be necessary for the industry to create a viable industry in the future once this crisis is over, and to protect jobs. Now, the Federal Treasurer, Josh Frydenberg, didn't rule out a bailout of Virgin Australia when he was speaking on AM radio this morning. And also we've heard from the Federal Industry Minister, Karen Andrews, when we asked whether or not a $1.4 billion bailout was worth it to keep Virgin afloat.
There are obviously a range of discussions with some pretty critical industries right across Australia, and we're going to be looking at what our sovereign capability is. Look, I don't want to comment directly on Virgin or any discussions that may or may not be taking place.
Okay, Steph, now let's go to the latest statistics on coronavirus around Australia, because there's been a lot of talk about this over the last couple of days because the trend has been going down. Some politicians have been keen to say they're encouraged by these early signs, but all of them are saying we should be very cautious about how we treat these daily figures.
Yes, Joe, that's right. If we just take a bit of a look at some of the national figures now, we're nearing 4,400 cases across the country, with sadly 18 deaths recorded. Now, as you can see, New South Wales is by far the worst affected state, with more than 2,000 cases there, and that follows a rise of 114 cases overnight. As you can see, Victoria is 821 cases, Queensland 689, and then there's a bit of a drop with South Australia and Western Australia both recording in the 300 mark, and quite a significant reduction there for the ACT, Tasmania and Northern Territory, with only 15 cases. But as you say, people are saying to exercise a bit of caution with this, because what we do need to see is whether or not these restrictions that have just come into effect as of midnight tonight, which is on public gatherings, banning any more than 2 people, except of course in your own household, being together, and just basically making sure that people stay at home unless they absolutely have to, for work, for food, for medicine, or for a little bit of exercise. What the health authorities are saying is that the key issue is those community transmissions, and the ones ones that we can't actually see as yet. Now, what we've seen in New South Wales, for example, is that they still have 250 cases of community transmissions or locally acquired cases where they don't know where that infection has been picked up. And in Victoria, there's 29 cases. Now, New South Wales Chief Medical Officer Dr. Kerry Chant just said that there has been a bit of a cluster of an outbreak among backpackers in the Bondi area as well as Waverly, and she is obviously wanting to see the testing increase a bit more and the potential of pop-up clinics. Now, we also heard from Gladys Berejiklian, the New South Wales Premier, about this and her concerns that we shouldn't be looking at those daily figures but at the possibility of these locally acquired transmissions. This is what she had to say.
We have had localised breakouts in areas like Waverly and Bondi, and as a result, Dr. Chant will instruct all the medical professionals in that area to increase the level of testing, to increase the number of people tested in that community, to really reduce the community-to-community transmission. We know New South Wales has taken every strict measure we can to date to really control the spread. What is of concern to all of us is that unknown, that level of community-to-community transmission that you might not pick up if people don't have the symptoms, and that's the real threat. People walking around without symptoms, not realising they have this disease.
Gladys Berejiklian, the New South Wales Premier there, and of course she is commenting on the fact that there's been a 350% increase in the past week in New South Wales of those community or locally acquired transmissions. Now, Dr. Kerry Chant, the Chief Medical Officer, also said that they have 35 people in New South Wales in intensive care. That's 16 people that are requiring a ventilator. Now, we also heard from the New South Wales Police Commissioner Mick Fuller, and he said since these bans have come into place, they've had to write out 13 tickets so far for people who haven't been abiding by some of these restrictions, and he certainly hopes that he's not going to have to write out many more, but obviously some people just aren't getting the message.
Okay, Stephanie Ferry reporting there from Melbourne. And just while we're on the subject of the statistics here in Australia and around the world, John Byrne-Murdoch from the Financial Times puts out a chart each day tracking how each of the countries, he puts out a number of charts, but there's one that we've been keeping an eye on, which is the coronavirus trajectory, total number of cases in what he describes as some of the major countries around the world. As you can see, the US is just off the charts now, literally, in terms of the number of cases. There are more than 150,000 cases in the US. It actually makes up a fifth of all the cases around the world now. And you can see Australia down here. So this is, across the bottom is the number of days since the 100th case, and the vertical axis is the number of cases in each country. So Australia now up over 4,000 cases. And we've heard Scott Morrison and some of the medical people referring to there appears to be the start of a flattening. You can see that happening there for Australia as opposed to what's happening to a couple of the other countries, but they're all cautioning the general public in terms of looking at these graphs and saying it's not the be-all and end-all, and there are different elements in different countries, but you can see what some of the officials are referring to in terms of some early signs of optimism for Australia. Now, 3 more crew members from the virus-plagued Ruby Princess cruise ship have been taken to hospital in Sydney overnight. The ship is at the centre of a major outbreak with more than 200 passengers contracting the virus. Reporter Rani Heyman joins us now from Sydney. Rani, g'day. So what's the latest from the Ruby Princess?
Hi Joe. Well, this morning we've learnt that, as you said, 3 more crew members have been evacuated off the Ruby Princess cruise ship, which is sitting just offshore from Sydney. Those people were brought to Botany by Water Police and New South Wales Ambulance Service. We understand that those people are being treated for respiratory issues, but that also comes obviously on the back of 3 other people being evacuated off that cruise ship, crew members, on Sunday night, and they are also in hospital. We heard today from the New South Wales Police Commissioner Mick Fuller that one of those 6 people is actually in intensive care in hospital at the moment. So it is quite a serious situation, but this cruise ship is at the centre of a stoush between the federal and state government after more than 2,700 crew and passengers were allowed to disembark the ship in Sydney more than 2 weeks ago. And after that happened, the cruise ship went back offshore and there remains around 1,000 crew members still on board that ship.
And Rani, so what's the situation for the passengers still on the ship?
So for the people still on the ship, the New South Wales government is providing humanitarian relief to them, so food and other sort of supplies. But at the moment, their future is sort of up in the air. It's not known when they'll be allowed to either dock in Sydney and then return back to their homes, or they may be out there for quite some time. The New South Wales Police Commissioner was saying that there are around 9 ships currently offshore from New South Wales. What he did say was that 2 women who were pregnant on those ships have been evacuated, and also another person who suffered a medical episode. But he said that 3 of those ships will be returning to addresses in New South Wales, but when that's supposed to happen, we're still not too sure. But he did say that this will take some time to resolve. He is in talks with the federal government today to figure out exactly what is happening with these ships. But he has said that he does not want these people coming ashore in Sydney and potentially infecting more people in the community.
Okay, Rani Hayman reporting there from Sydney. Might just go to the John Hopkins University website, which has become kind of the go-to website in terms of the overall picture around the world with keeping up with what's happening with coronavirus. So up in the top left-hand corner, you can see there the total confirmed cases now more than 750,000 and 37. So that's just past 37,000 deaths around the world. Italy accounts for almost a third of those deaths, and the Spanish death toll has risen up over 7,000. Now, if you just click on what's happening in the US, it's just extraordinary how the cases are skyrocketing there. So 160,000 cases now in the US. The death toll just about to hit 3,000. So the US is confronting an extraordinarily difficult situation there. We heard yesterday from the Chief Medical Officer there in the US, Anthony Fauci, concerned that there could be up to 200,000 deaths in the US because of this coronavirus outbreak. So the US Army Corps of Engineers will help open a temporary field hospital at a convention centre in New York City. President Donald Trump announced an additional 2,900 medical beds will be available to treat patients who are not infected with novel coronavirus. The centre is designed to help with overflow at medical facilities in New York, which has become the centre of the outbreak in the US.
This morning I spoke to our nation's governors to help each state get the medical supplies they need. And yesterday, Vice President Mike Pence asked our nation's hospitals to begin reporting total bed capacity, ICU bed capacity, ventilator capacity, and vital medical supply levels on a daily basis. And Mike, thank you for the great job. Thank you very much. In New York, the 2,900-bed hospital under construction, which is now completed. They completed it in 3 days, you might say 3.5 days, at the Javits Center. Will be completed today. And when you look, so they're going up. I think we're going to be adding some more beds, which will be completed today. And nearly 3,000 medical beds will become operational. The U.S. Navy ship Comfort also arrived today, equipped with 12 operating rooms and 1,000 hospital beds. Work has begun on additional temporary hospital sites, including a 600-bed capacity nursing home facility in Brooklyn and numerous floors of a high-rise building on Wall Street. So it's been really pretty amazing what they've done. The Army Corps of Engineers, what they've done, they just completed, think of it, a 2,900-bed hospital in New York in just about 3 days, maybe 4 days. And the whole city's talking about it. On top of that, we floated in a great ship, which is going to be 1,000 rooms, which is being used for patients outside of what we're focused on, and that will free up a lot of rooms for what we're focused on. So it's been great.
And the Governor of New York, Andrew Cuomo, has warned that what's happening in his state will happen elsewhere across the US. New York has become the centre of the coronavirus outbreak in the US, with 60,000 reported cases and more than 1,200 deaths. A US Navy hospital ship has docked in New York to relieve pressure on the city's overstretched hospitals. Mr Cuomo has described the scale of the outbreak as staggering.
Anyone who says this situation is a New York City only situation is in a state of denial. You see this virus move across the state. You see the virus move across this nation. There is no American who is immune to this virus.